Hi everyone, we are the Group 7 and we will discuss about Betty Neuman's theory, the Neumann system model. I will be with my group mates Esteperi Boriba, Divina Galvez, Deborah Ainis, Asha Roshan, The Shuttle, and me, Andrea Nasir. First, I'll discuss about Betty Neuman's biography. Betty Neuman was born on 1924 in Lowell, Ohio. She obtained her RN diploma in 1947 from the People Hospital School of Nursing in Akron, Ohio. In year 1957, she had her double major in psychology and public health in University of California at Los Angeles. In 1966, she obtained her master's degree in mental health and public health consultation in University of California at Los Angeles. Betty Neuman also got her doctoral degree in clinical psychology in Pacific Western University in year 1985.
As a mental health counselor, she developed her nursing model of the whole person approach based on a system adaptation framework. Betty Neuman developed the system model based on the following influences. The first theory is Gestalt theory. According to Gestalt theory, it describes homeostasis as the process by which an organism maintains equilibrium and consequently its health under varying conditions. According to Marx, philosophy suggests properties of parts are determined partly by the larger wholes within a dynamically organized system. According to Desjardins, it explains philosophy of the wholeness of life. According to Silla's definition of stress, any tension producing stimuli that causes a response. It can be positive or negative.
Theory development. Neumann system model was developed in 1970 and published in 1972. Neumann system model defined as nursing is more than caring for an illness, but is about viewing the patient as a whole, holistic care, and assessing every aspect of an individual that affects health, including emotional and spiritual well-being.
First, published as model for teaching total person approach to patient problems in nursing research.
Conceptual model. The conceptual model was developed to explain the client system as an individual person for the discipline of nursing. The model can be applied to an individual, a group, a community, or a social issues, and is appropriate for nursing and other health discipline. A conceptual model provides a distinct frame of reference for its adherents that tells them how to observe and interpret the phenomena of interest to the discipline. Neumann chose the term client to show respect for collaborative relationships that exist between the clients and the caregiver in Neumann's model, as well as the wellness perspective of the model.
Major concepts and definitions. Holistic approach, client view as whole. Human being is viewed as an open system that interacts with both internal and external environment forces, or stressors. Human view the person as a client or client system. This client can be an individual, a family, a group, a community, or a social issue.
Environment is seen as internal and external influences. Stressors can threaten stability. Three environments were classified: the internal, external, and created.
Internal environment exists within the client system. All forces and interactive influences that are solely within boundaries of the client system make up this environment. The external environment exists outside the client system. And created environment is inter, and extrapersonal factors.
In regards with health, stability of system is important. Wellness model. Stability is associated with total system needs being met. In nursing, nursing concerns whole person. Perception influences care.
The Neumann system model provides a way of looking at the domain of nursing: humans, environment, health, and nursing.
The client-to-client system consists of a flexible line of defense, the normal line of defense, line of resistance, and the basic structure energy sources at the core of the concentric circles in. Normal line of defense is an adaptation level of health developed over time and considered normal for a particular individual, client, or system. It becomes a standard for wellness deviance determination. Flexible line of defense is a protective accordion-like mechanism that surrounds and protects the normal line of defense from invasion by stressors.
Lines of resistance. Neumann identified a series of concentric broken circles that surround the basic structure. When the normal line of defense is penetrated by environmental stressor, a degree of reaction or sign or symptoms will occur.
The basic structure or central core is made up of those basic survival factors common to the species. These factors include the system variables, genetic features and strengths and weaknesses of the system parts.
Major concepts and definitions. First are the 5 client variables. Neumann identified 5 variables that are contained in all systems. These are physiological, psychological, sociocultural, developmental, and spiritual. Neumann offers the following definitions for each variable. First is the physiological. Physiological refers to the bodily structure and function. Examples are autoimmune response, degree of mobility, and range of body function. The second client variable is psychological. It refers to mental processes, relationships, and emotions. Examples are attitudes, values, expectation, behavior and coping patterns, and conditional responses. The third client variable is sociocultural. Sociocultural refers to combined social and cultural functions, expectations, and activities. The fourth client variable is developmental. Developmental refers to life development processes. These are age, degrees of normalcy, and factors related to present situation. Spiritual refers to spiritual beliefs and influence. Examples are hope and sustaining forces. Spiritual is an innate component of the basic structure and views as being on continuum of development that penetrates all other client system variables and supports the client's optimal wellness.
Definition of stressors. A stressor is any phenomena that might penetrate both the flexible and normal lines of defense, resulting in either a positive or negative outcome. Intrapersonal stressors are those that occur within the client system boundary and correlate with the internal environment. Interpersonal stressors occurs outside the client system boundary, are proximal to the system, and have an impact to the system. Extrapersonal stressors also occur outside the client system boundaries but are at a greater distance from the system than are interpersonal stressors. An example is a social policy. More than one stressor could occur simultaneously. Same stressor could vary as to impact or reaction.
Degree of reaction represents system instability that occurs when stressors invade normal line of defense.
Prevention as intervention. Intervention modes for nursing action and determinants for entry of both client and nurse into the healthcare system. Nursing intervention occurs through 3 prevention modalities. These are primary, secondary, and tertiary prevention. Primary prevention occurs before the system reacts to a stressor. It includes health promotion and maintenance of wellness. Primary prevention focuses on strengthening the flexible line of defense through preventing stress and reducing risk of factors. Secondary prevention occurs after the system reacts to a stressor and is provided in terms of existing symptoms. Secondary prevention focuses on strengthening the internal line of resistance and thus protects the basic structure through appropriate treatment of symptoms. Tertiary prevention occurs after the system has been treated through secondary prevention strategies. Its purpose is to maintain wellness or protect the client system reconstitution through supporting existing strength and continuing to preserve energy.
Reconstitution, the return and maintenance of system stability following treatment of stressor reaction, which may result in a higher or lower level of wellness. Baby Lisa is a 13-month-old girl admitted to Sick Kids Hospital triage. She has been found to have infective endocarditis as a result of an infection contracted through partial cardiac repair surgery which shunts placed. Prior to admission, her mother, Mrs. Clark, described her daughter's symptoms of difficulty of breathing in severity, cyanosis, and sudden temporary loss of consciousness. She had a fever that would come and go for the last week. The infant was crying a lot, and cuddling or any comfort measures given were not helpful. Her health history revealed a diagnosis of tetralogy follow at 4 months of age due to previous history of tachypnea and breathing difficulties, accompanied by cyanosis, poor appetite, lethargy, excessive crying from birth onwards. At the time prior to diagnosis, she was referred to the pediatric cardiac clinic for further investigation. ECG, EKG, blood tests, chest X-ray, pulse oximetry, and catheter were performed to come to a conclusion of tetralogy of follow. It was recommended to the parents that baby Lisa would need to have heart surgery to correct this. It was also recommended that baby Lisa have shunts placed in the heart. This was to alleviate some of the stress caused by the condition temporarily until she reached an older age for full corrective heart repair, as she was considered high risk to have the full surgery at that time. The parents did as recommended, attended follow-up appointments at the cardiac clinic until the partial repair would be done. The shunts were placed when baby Lisa turned 1 year old. Recovery from initial surgery for shunts was unremarkable. Mrs. Clark is a stay-at-home mother of 5 kids, ranging from 13 months to 17 years old. She is married and her husband works long hours and is away from the home for most of the day. She has no other family to help out with the household and children apart from her older daughters. After the initial diagnosis of baby Lisa, the parents have stated they have been very careful in limiting her everyday activities due to her heart condition. The mother expresses concerns that baby Lisa will not have a normal childhood and miss out on a lot because of her heart condition. She describes herself as a positive person but worries about the impact this has on the whole family.
Patients experience physiological variables that may affect flexible line of defense. These are difficulty of breathing and sudden loss of consciousness. Cyanosis is considered as a line of resistance, while normal line of defense is normal respiratory without any difficulty in breathing, and the patient should be alert. Liza has heart structure deformities due to her condition of tetralogy of Fallot and infective endocarditis. Patient is advised to have temporary heart surgery since she was at high risk to have full corrective surgery. Absence of deformities is a sign of functioning and normal heart structure. Liza's psychological and social factors were also affected. Patient has limited social interaction that leads to anxiety, and Liza might develop mistrust according to Eric Erikson. Moreover, Patience usually cries whenever she wanted to play with other children. As a normal child, social interaction is important as a part of psychological development. Patient's developmental status was compromised due to her heart condition that stops her interaction with other children.
Good morning. My name is Bethany, and I will be your daughter's nurse for today. How is everything doing?
Okay, I guess.
And who is this lovely young girl with you?
This is my older daughter, Stacy, who has been helping me out with everything.
Oh, how nice. You are such a wonderful daughter being here for your mom and being so helpful.
Yes, she has really been a great support for me. Hi.
And this is Lisa, your other sweet and strong baby girl?
Yes, this is my darling baby girl who has been through a lot, but yes, so strong.
Okay, well, I am happy to meet all of you, and how are you all doing? Have you been staying overnight, Mrs. Clark?
Yes, I'm so tired, but I don't want to leave my baby girl.
I understand. You are doing what most moms will do. It's not an easy situation seeing your baby not well, isn't it?
Yes, it's so hard to see her like this.
Tell me how you have been coping with it. You have a lot on your plate to deal with.
Well, I have 5 kids. My 2 eldest daughters have been super. Stacy has been helping me here, and my other daughter, Jessica, has been at home caring for my 2 younger ones, while my husband works very long hours.
Oh, I see. That is great that they have been helping you out.
I don't know what would I do without them. It has been easy with my husband not around as much, but we get by. I do worry though my older daughters are missing out on things they should be doing as teenagers and having a normal life.
I understand what you are saying.
No, Mom, we are fine helping. We are big enough to help out.
Well, your mom sounds like you have really done a great job raising such caring and responsible children. You should be proud.
I am proud of them. That is why I worry that I am taking away from them what they ought to have. We reassure them it will get better through time.
Absolutely. You will get through this as a family, and this is great to see that you seem like a tight knit and strong family. So, Mrs. Clark, I am going to complete some of my assessments of baby Lisa, and in the meantime, if you want to step out for a break, you may, or you are more than welcome to stay. If you have any further questions, or there is something you want to let me know about Lisa, please do not hesitate to tell me.
Okay, I would like to say
How was her breathing and color overnight in the time that you saw her?
she had some struggles with breathing after 12 a.m. and went through a spell, as we are used to, but nothing that stood out for me.
And how has she been eating?
Well, I would like to see her eat more than she is. She gets very restless and it's hard to get her to eat sometimes. I worry about that what it means for her for her growth and development.
Yes, absolutely.
Does everything seem okay to you?
So far, everything seems to be functioning as it should.
I just cannot believe how this turned out with Lisa and her getting this infection. Sometimes I wish I had done more when she first had a fever a few weeks back. I just did not think it was related.
The important thing is that you should brought her in when you did, shortly after her surgery, and she is getting the help she needs now.
I worried through the impact this all has on how Lisa will do as she gets older. Will this make her fall behind other children her age? My husband and I always been careful not to let her overexert herself in activities than she does for this temporary operation. to put in the shunt and this happens.
You have done a wonderful job so far considering the stressful situation. Everything in terms of her recovery and development for her age are normal. You could not have predicted this happening, and what is important is putting your efforts towards baby Lisa and how you can make her feel comfortable. You will get through this.
Thank you, Bethany, for your kind words. I appreciate it. My faith is what keeps me going for my little one. I say little prayers here and there and ask for guidance.
That is good. If that is what helps you to focus and keep your mind in place of positive thoughts, then you keep doing what you are doing.
I will. It helped me so much in such a difficult time.
I am finished with the assessment and things seems to be fine. Lisa is coping well with her situation.
I am glad to hear. I do worry, though, the impact it has on our family. My husband has really not been around as he works long hours.
Oh, really?
Yes, sometimes I feel like he works to avoid dealing with the situation. It's hard. It's so hard, though I have older daughters, but often worry about how my 5 and 7-year-old are doing. I do not have much time for them.
Are there any other family members that are able to help out, such as in-laws or siblings of you or your husband?
No, they all live in another country.
I see that must feel overwhelming at times.
Yes, but as I mentioned, my strengths are my 2 older daughters. I just wish my husband would take more of an active part in our situation.
I understand. Mrs. Clark, I am just going to write down some notes and I will come back in a few minutes and we can discuss how we can tackle some issues that you have mentioned.
Sounds good.
Application of the 5 variables in the case scenario. For physiological, baby Lisa had developed infective endocarditis. She had fever, difficulty of breathing, cyanosis, and temporary loss of consciousness. She had a history of cardiac defects. Tachypnea and cyanosis are present whenever there is exhaustion. For the second client variable, the psychological, the nurse observed that the mother is worried about the condition of her daughter that will affect on her developmental stage and for her future. For sociocultural, since baby Lisa diagnosed of cardiac structural defects, the parents told to the nurse that they have problem on finances, but the father affirmed that he will double his work to help the child. For developmental, baby Lisa is 13 months old, a girl who was born with cardiac structural defect, thus is limited to several activities that do not require excessive energy consumption.
For spiritual, the mother said that her faith helped her to become strong for her child. She prayed and asked for guidance for her daughter.
Application of environmental stressors to baby Lisa for intrapersonal stressors. Client had cardiac structural defects. She has ineffective coping since she is not mature enough. She could not fully comprehend why she has limited activities. Due to her defect, she could not do like other kids can do. For interpersonal stressors, she is afraid that every time she goes to the hospital, she will get hurt. Her parents do not have the means to have her operated or referred to a cardiac center. Her parents limits her from playing and sometimes refrain from playing extraneous activities. For interpersonal stress, for extrapersonal stressors, client activities such as running or jumping are detrimental to her health. Questions why she could not live a normal life. If she had enough toys, she would be happy even without her playmates. Clients not fully express her childhood because of limited activities.
Hi, Mrs. Clark. How have things been since we last spoke?
Lisa has been fine. Nothing that concerns me at the moment. My daughter Stacy just went home to get some things for me.
Okay, great. It will give us some time to discuss some ideas I would like to discuss with you regarding your concerns.
Okay, that sounds great. I would appreciate any advice or insight you have.
You expressed to me that you were concerned that Lisa was not eating enough, and so I was taking you and we could come up with a schedule that would address Lisa's nutritional needs. I can refer you to a dietitian here at the hospital so that we can make sure he is getting regular intervals of food and the right nutrition to keep her strength up. It is very important that she gets regular feedings to encourage health and healing given her health condition.
Yes, I agree. She needs a more proper schedule of feeding instead of whenever.
Great. So we will aim for sticking with the feedings regularly scheduled and alternate according to how she is feeling. You also discussed some issues regarding family life, and it seems as though, despite what you have been through, you do seem to have a strong family bond.
Yes.
I was thinking to strengthen this bond further. Perhaps it will be beneficial if the whole family, including your husband, agrees to meet with a social worker to go over how everyone is feeling about the situation and its effect on family life.
Okay, I think that can work.
Okay, I will put that referral forward for you. You also express your ability to cope what was also due in part to your faith. We have various members of faith organizations that can also come and talk about how you are feeling with all of this if you like.
I did not know they had this that would be helpful from time to time, so I do not have to voice all my concerns on my daughter.
Great. Also, the other concerns you mentioned were with how your daughter's development will be affected and this implication in the future after these procedures. I think that a good conversation with some of the cardiac specialists at the hospital will be beneficial and offer some reassurance for you. Would you be interested in that?
Yes, absolutely. I sometimes feel everything is so rushed and then feel that I cannot really ask as someone is busy with so many other sick patients too.
Not at all. Rest assured that they are here to help. Everyone is here to assist in any way to make things. Is there anything else that you would like to discuss that is important to you and the family that you feel I have missed or should include?
I think that is all. Thank you so much for your help in making things more clear.
I am here to help in any way I can. You're welcome.
So, in our scenario, baby Lisa was not eating enough. Because of that, mother got stressed. That was the main concern. Then the workload of Mrs. Clark and her partner. So we have to find out the solution to reduce the stress. So in our scenario, we need to address Lisa's nutritional needs. So we need to refer her to the dietitian. So this way we can maintain her hydration and normal weight. And also for reducing the workload of the family, we can advise for the respite care to help the family members. Based on our scenario, we can educate the mother about the proper feeding techniques and also about the frequency of breastfeeding. Then we can connect them with the faith organization. It helps them to reduce the stress level. And also we can connect them with the supporting groups. This way they can reduce stress.
Here's the list of our references. Thank you so much